Mole clinic, you can choose between a mole check with mole mapping or without mole mapping. In case of mole check without mole mapping, again there is a head-to-toe examination of the whole skin surface, and in this case I use my handheld dermatoscope to have a closer look on the moles, and it shows a 10 times magnification and very detailed image of the fine structure of the moles. And in this case I take pictures of the moles when I see a kind of asymmetry. When you come for a mole check with mole mapping, it's different. Again, there is a head-to-toe examination, but in this case, when I finish the examination, I take pictures of each and every mole without any further selection. And in case of your first examination, I have a second look on all of your moles on a big screen, and then I provide a detailed report afterwards. But if this is a follow-up examination, in that case I'm going to compare the moles from a previous examinations. So as you can see it on the screen, on the upper part of the picture there are the close-up images of the moles, and on the bottom there are the high magnification dermatoscopic images. On the left hand side you can see the previous pictures, and on the right hand side the current set of images. And if you have a look, this is a comparative analysis of moles, and if you can see on the bottom there is a change in the size and in the fine structure of the mole, and because of this I recommended removal of this mole, and from the histology it turned out to be a skin cancer, a melanoma skin cancer, but since this is an early stage it means 100% cure for the patient, but if it were a later stage melanoma, there is a higher risk of spread. So screenings are paramount. If I see something suspicious or very atypical, asymmetrical, I recommend mole removal. And if you choose to come to me for the mole removal, I'm happy to make this procedure. And when I'm talking about mole removal, I mean the removal with scalpel and stitches. And in this case, I send the tissue removed to histology, and they provide us with a written report, and which tells clearly whether it was a benign mole or something else, for example, a skin cancer or melanoma.